Hi, I'm Dr. Angeli Maun Akey.
And I'm Dr. Kathleen O'Neil-Smith.
Welcome back to the FIRRIMup Doctors Good Medicine docu-series.
We are so glad you joined us.
We want to provide you with credible health resources, guide you in your treatment options, and fire you up to take control of your health.
Hello everyone, welcome back for another week of the FIRRIMup Doctors webinar series. Today is the fourth week in our 5-week COVID series, and today we'll be talking about COVID illness management. So what to do if you or a loved one gets sick. It's going to be really useful information, but also very reassuring. We have the awesome FIRRIMup Doctors, so I'll go ahead and pass it on to them, Dr. Angeli Akey and Dr. Kathleen O'Neil-Smith. Welcome, guys.
Hi, Audrey. Hi, everybody. Thank you for coming. We're in the middle of a series on COVID series, and I'm sure Dr. Kathleen's stuck in clinic because COVID is so busy for her up in Boston. So we'll go ahead and get started, Audrey.
Okay.
Next slide. So we made it through week 1. Hi, Dr. Kathleen. I'm glad you could make it. I know how busy it's been up there with COVID.
Very, very busy. Lots of sick people. Trying to help them get better.
Yeah, I know. And you have the tools to get them better.
Yes.
So I was just going through the schedule that we're now on week 4. We did back to the basics, prevention, post-exposure prophylaxis. And now we're going to talk about COVID illness management. Once your castle walls have been breached, what to do.
What to do? Let's go. Can you hear me better now? If you give me a thumbs up, that will be good. Thank you, Peggy.
So going back to this original cartoon over here on the left, you have, post-exposure prophylaxis. Well, pre-exposure, then post-exposure. We've brought you through that. And then now we're going to talk about the difference between early and late treatment of COVID illness. And I think this would be a good time to talk about the difference between PCR positive swab and no symptoms, which simply you have a positive swab or a positive test, but you're not ill. So to us, COVID disease or COVID illness is a positive test plus symptoms. And then so back to the basic, those symptoms could be fever, headache, cough, malaise, or just feeling lousy like you have the flu, those of you who have had the flu, and isolated GI symptoms, nausea, vomiting, diarrhea, about 3 to 4% of the time. So symptoms plus a positive test equals COVID illness, okay? The difficulty with our statistics as a nation and as a world is there's no real difference in reporting between positive test and positive COVID illness. Right, Dr. Kathleen?
That's true. And I think one other point that's really important is that symptoms without a test that are consistent with COVID are consistent with COVID, and you're infected until proven otherwise. So a positive test without symptoms is not an infection of COVID. It's not infection with COVID. Symptoms are an indication of an infection with COVID, and then a positive test will confirm it.
That's a huge point. And we had talked about that earlier, that, early in the spring, there have been patients of ours that loss of taste and smell, fever, flat on their back, multiple tests negative, antibodies negative, but yet they're suffering with what I'm calling post-COVID syndrome, because to me, clinically, they had COVID. And none of these tests are 100%. So point well taken, Dr.
No, I think even clarifying that they had symptoms of COVID, they had acute COVID, and they had all negative testing. And now they still have residual symptoms, which we term post-COVID syndrome, because even though they tested negative, their entire symptomatology was consistent of COVID and nothing else was found. So it's COVID unless proven otherwise.
And that's why you need a doctor. to really put this together.
Exactly.
It's not about just testing. And we are going to talk about that next week, PACS, post-acute COVID syndrome. That's next week. But for now, let's go to this lady who's sneezing. She's got early symptoms, early treatment, and we're going to differentiate that from the progressive course of COVID illness that requires emergency attention and hospitalization.
So she has symptoms. So we're assuming she's sick. Hopefully she will be able to be determined with a test as well. But if not, she's sick, and we're going to try to treat as quickly as possible.
So I had a consult today with a patient who's been doing her due diligence. She's in her 60s, mid 60s, who has autoimmune tendencies, so doesn't want the vaccine. She just wanted to ask, Dr. Akey, what will happen if I get sick? And so she'd been doing a reading, and she said, and then at the end of the conversation, she said, so will I get doxycycline? Will I get inhaled prednisone? Will I get oral steroids? You know, so she had done a reading, but what I was trying to message to her was, it's a sequence of interventions, starting with, first of all, let's fortify your immune system with basic immune protection. Should you have exposure, let's triple that, which you already learned from the past 2 webinars. But then with early treatment, it's important that you see us early, because the tempo and the treatments depend on your symptoms as well as your risks.
The prescriptions. So the addition
Yes.
up of the fortification, the prescriptions that we will use at your local pharmacy will depend upon the progression of symptoms and the tempo of your symptoms, for sure.
Yeah, so then as if you were to progress, and we know that because if your oxygen starts dropping, for me, I'm really alarmed if you're below 94% and the trend is down, then we consider further evaluation and treatment, potentially even the emergency room and hospitalization, because the treatments at that point are different. Those involve steroids. Some hospitals are using convalescent plasma and remdesivir and other treatments than early outpatient treatments. So I think Dr. Kathleen and I do primarily on it right away, post-exposure treatments and early outpatient treatments. She's had great outcomes. We've had great outcomes, over 100 ill COVID patients managed. 3 died. One was an 87-year-old lady with chronic lung disease, died in the hospital. The second was a 90-year-old woman who joined our practice because she had COVID. We sent her to the hospital. She got admitted. Then she died a couple of days after at home. And the third was a beautiful, stubborn man who believed in the conspiracy theory with this COVID. And even though he hadn't been seen in 18 months, he's obese and diabetic. We saw him immediately when he was positive for COVID after going to a funeral. And he told me his oxygen was 85%. And then it went up to 90%. I said, nope, that's emergency room right now, especially because he was over 300 pounds and diabetic. So, but he refused despite all our calls and begging, pleading, borrowing, please go, please go. He wouldn't go. His family supported him not going, and he died peacefully at home a couple of days ago. But those are our 3 deaths. I've been pleasantly surprised that people who I thought would do terribly in outpatient management of COVID have done extremely well. Diabetics, hypertensive, obese people. So therefore, we're very confident that we can manage you early in early treatment. Dr.
Well,
Kathleen?
I want to really just pause right now and have everybody just take a deep breath, because when I speak to my patients who have had COVID and have recovered, and none of them are kids at this point, they're mostly between 40 and 60, early 60s, and they're healthy, they're well. And what I want to say is I asked them what was the worst part. They had symptoms. They had fevers, they had night sweats, they had the whole thing, chest symptoms, you name it. The worst part is the fear of what's going to happen next. So I want to calm it down when we talk about these deaths. And I want to just say that the whole goal, the raison d'etre for doing this for you, is not to frighten you. The whole goal is to empower you so that you can be on pre-exposure prophylaxis, fortification of your immune system, and so that we can help you be treated as early as possible, because it is absolutely clear with anything that the earlier you treat upon having symptoms, the outcomes will likely be better. So the goal is to be sure that we give you the appropriate prescriptions, that we stay in touch with you and continue to adjust the prescriptions as needed and have the medication available to you within 6 to 12 hours. I mean, we're working hard on those things. So it's really, really important that we just all take a breath. Most people do not end up in a hospital. Most people do not end up dying. It's still less than 1%. So we don't have to be so fearful, considering that that was the worst part for my patients who actually recovered, was the fear of what happens next.
Yeah, I totally agree with that. And I think the big pandemic is fear at this point.
Right.
And I think we
Right.
don't have to be fearful because we
Right.
have progressive, aggressive ways to manage our population.
Right. Next slide. Go ahead, Angela.
So this came from, so basically, just to remind you all about the symptoms to the left, I think you all know it. It's flu-like symptoms plus loss of taste and smell. When I hear that, I don't necessarily need a swab because it's probably COVID. And then in our book, we wrote about kitchen and bathroom first aid, inhaled colloidal silver. You could use up your nose. We have Argentine silver. It's also on the website. If you have a fever, use Tylenol first. If you're using high-dose Tylenol, we'd suggest a supplement called N-acetylcysteine to help your liver with that high-dose Tylenol around the clock. Initially in the spring, they said don't use ibuprofen, but a retrospective review that recently published said it was probably okay to use ibuprofen. There was concern initially last spring that ibuprofen would impair your immune system to fight, but there really is no evidence of that. And then taking hot steam showers with eucalyptus and natural ways to open up your airways is very, very good. Don't forget the 3 instruments that we've asked you to pick up like a long time ago: a thermometer, a blood pressure cuff, and a pulse oximeter. If you have those 3 instruments, we can manage you on telehealth, because based on that data, you're going to check yourselves and check in with us every single day. If you get COVID, you have that opportunity.
Yeah, you want to be prepared. You want to have things on hand. You don't want to wait till your exposure and then an illness in order to get prepared. That's the wrong time to start digging the well after you're thirsty, so to speak. So definitely be prepared and have your bathroom stocked with what you think you'll need, including, the things above, and potentially Advil, which a lot of my patients felt better with, particularly with their headaches. Next slide.
So these are straight from CDC guidelines. The emergency warning signs to seek emergency medical care is if you have trouble breathing, if you've got chest pain, it can uncover underlying heart disease. If you're confused, if you have really messed up sleep, blue lips, face, or nails, that means you have hypoxia, most likely low oxygen tension, and you need oxygen. Although with COVID lung disease, the lung complications, they say that the patients look like happy hypoxics. They don't look that short of breath. But if you have blue lips or nails or face, that you need to call 911 or go to the emergency room.
Yeah, blue for people is never good. Pink is better. Just saying. Little pink. Pale is even better than blue. We don't like blue. I love blue, but not in people. Next slide. So testing positive versus illness. We just spoke about this. My concern is the people who tested positive, and just like on the left in the picture that you see, where both lines, the control line and the positive line is positive, but they have no symptoms. They think they've already had COVID. So they think they don't need a mask. They don't think they need to distance. They think they can be with their grandparents. That is not true. It is not true. So I would say that we've got to really be clear about this. You still can be transmitting the bug. Remember, we talked a lot about the viral load last week. So it may be that when you test positive, some of it is dead bug. Maybe 80% is dead bug. Maybe 20% is live bug, but it's not a big enough viral load to make you sick. Maybe somebody else that gets your 20% live bug from whatever caused your positive test may have already been exposed to somebody else, and they may already have 20% from somebody else on board, which your cumulative 20% added to it could make them sick, like an elderly person who could be more at risk. So it is really important that you understand what a positive test result means. COVID illness, you've got the symptoms. I also won't tell you who said this, but I also have somebody who should absolutely understand this in my environment, that their someone in their family had a vaccine and had symptoms. And I was shocked to find out that they thought the patient was then symptomatic. I mean, contagious. The patient had symptoms because the vaccine was put in the arm. And so they thought the patient was symptomatic and could transmit it to them. So they left the house for 2 weeks. Not necessary after the vaccine. If you get it and you put it in the arm, it's not going to get to you. So it's really important. If you got it through your airway, through your nose, in your nares, or in your throat, then you're symptomatic. But if you got symptoms because of a vaccine, you are not necessarily going to transmit it. We already went over the COVID-19. We have symptoms, a live bug. You could
So
still
to your
test it.
point about that, so when you get a vaccine, your body is seeing faux COVID. It's fake COVID. It's the antigen or the protein that's activating your immune system. So you could have COVID-like symptoms around the time of your vaccine.
Mhm.
Next slide.
So caring for
So I know a
others.
lot of you are caring for other people. If you looked at the initial Wuhan studies of transmission, household transmission is 17% and spousal transmission is 27%. But really, even within the same house, if you quarantine, you can have zero transmission, which we've seen over and over again. So support, if you're the caregiver, obviously this mom has to take care of her child. Listen to your doctor, make sure they're hydrated, and protect yourself. So eat and sleep in separate rooms, wash your hands, the basics. We're back to the basics again. Track your own temperature. So yeah, that's a good point. If you're caring for someone else, you should be monitoring with those 3 devices. Next slide. Okay, so a lot of questions about ivermectin. So I promised you all we'd bring it up here. So you should study this website yourselves if you'd like, flccc.net. Frontline COVID-19 doctors, COVID-19 Critical Care Alliance. If you read Kick COVID-19 to the Curb, you know that we love Dr. Paul Merrick, who is chair of critical care medicine at Eastern Virginia Medical School, and very progressive. I mean, he was using intravenous vitamin C for right off the bat with COVID in the ICU. Well, he got his fellow intensive care doctors together because they were all so concerned about what can we do at the front end? Why, you're filling up our ICUs. And so a bunch of prominent, well-published intensivists, intensive care doctors got together and formed this FLCCC Alliance with the mission of finding repurposed medications to help at the front end of COVID so they don't end at the back end of COVID intubated in their hospitals. And so I really like this. I think it's a very strong academic group. Dr. Corey did an impassioned plea before the Senate on December 8th of 2020 to investigate ivermectin, because the group had looked at the world literature on ivermectin in decreasing morbidity and mortality in COVID, and they were convinced that it actually works. And he, for some reason, since that time, the YouTube has taken down that Senate plea on December 8th, but you could try to look at their statement online about why they think it got taken down. But long and the short of it is, since November, we've been following that group, and since November, we had been using ivermectin in our practice, and extremely well. Patients will tell me, like, you give them a dose, which is 0.2 milligrams per kilo with early treatment. By the next day, they start feeling better. Not 100%. This protocol didn't prevent one hospitalization, but most of the time it works extremely well. So ivermectin little bit of background, it's actually been administered to 3.7 billion people in the world. It won the Nobel Prize for eradication of parasites, and mostly in third world countries. It's very, very safe. And as far as I could tell, there's really no downside. I mean, despite that number of doses, there's been some reports of headaches, etc., maybe some liver, but not nearly the complication rates that we are seeing with the COVID shots or the COVID vaccines that are given out. So we're a fan. We like ivermectin. In addition, the immune fortification protocol they use is D3C quercetin to stabilize those mast cells, as we taught you last week, zinc, melatonin, and aspirin. So that's our take on early outpatient intervention of COVID illness.
Well, let me say something. So medicine is an art. And so I think one of the things you'll find is that there are a number of doctors, we talked about this last week a little bit, that have their websites very similar to FLCCC. I don't think really anything has to be debated because most of them include ivermectin. If they don't, then there's a problem because ivermectin is pretty well studied, well used, and there's no downside. So ivermectin will generally be between 10 and 12 milligrams a dose. So 0.2 milligram per kilogram will come out to 10 to 12 milligrams per day while you're using it. And you could use it for 3 days, max 5 days. So there's a lot of, subtle differences that you don't have to belabor or get caught up in. Vitamin D will be there, and people will suggest 10,000, 50,000, 4,000, whatever it is, on every website. Vitamin C will be on every website. Quercetin will be on every website. Zinc will be on every website. Melatonin may or may not be, and aspirin may or may not be, or Advil or anything else. But definitely the first 5, ivermectin, D3, C, quercetin, and zinc, will be on all of the websites. So even between Dr. Akey and myself, we may have a little bit of a nuance, and we may use ivermectin with something else or not, depending upon the patient. I don't think that beyond what you're seeing here, you have to feel stressed or confused or anything like that, because I think in general, medicine is an art, and we all have egos, and we all think we have a little bit of a different twist on how it could be. So it's really, really important that there's no one website that has the answer. This is just best practices that we are trying to educate you on, with the understanding that medicine is an art, and everybody can use different amounts of different meds. And we really don't know that one dose is better than another, but we do know high doses of some of these things are better when you're sick. Hopefully that's clear.
Yeah, so think of this as a framework, and then we would modify it based on your own individual situation. For example, the mid-60s-year-old lady who I told you about earlier, who had the consult, I knew that based on a brain CAT scan, she had microvascular small vessel disease to her brain. And so therefore I added nitric oxide support, so Neo 40 twice a day in terms of her prophylaxis. And certainly if she were to get COVID, we would definitely be using something to augment her nitric oxide. So remember, these are kind of just the skeleton, and we nuance it based on your own body and your own situation.
And I'm such a believer in personalized medicine. I do not think there's a one size fits all. I think that there's a framework, and the key is to always work with a doctor who knows you, or at least who will listen to you and understand what the problems are that you're presenting with, because there are a lot of nuances into what people need, and it should not be something that we pick off a screen or a website and directly just give to you without ever thinking. If that could happen, there isn't one patient in this country that shouldn't have access to this. Every PCP should be giving this to people. They're not, because they don't think they understand. But if they went back to their medical school classes and thought about their microbiology, whatever, they would be able to know how to use something like this that's so simple, and they could just use this protocol. I like to pride myself in knowing a little bit more about my patients and having different data on my patients that individualize their treatment plan, and then giving them a nuanced version of this based upon what I know about them and what their risk factors are.
So many of you, and you do a great job, Dr. Kathleen. Many of you have been asking about ivermectin, and you don't live in Florida or Massachusetts where we're licensed. So we would direct you towards the website that's at the bottom. They actually have doctors who understand the iMask Plus protocol with a directory. We're in that directory. But many of you don't belong to our practices. In addition, if you are in Florida or Massachusetts, you could certainly email. If you don't belong to our private practices, you can email FIRRMupDoctors@gmail.com for a consult, a COVID consult. We'd be happy to take care of that as well.
Yeah, we're happy to take care of you. If you can find somebody that will take care of you in your state on this website, we're happy to help you.
I probably, though, if you go to your primary care doctor and you say, I want a prescription for ivermectin, they're probably going to say there is no evidence that helps. And then you're going to refer them to the website. And then there is open access article that was just published in a very prominent journal called Chest. And it's just this month. It was from Broward County, Florida. And it's called The Use of Ivermectin is Associated with Lower Mortality in Hospitalized Patients with Coronavirus Disease in 2019. It's called The Ivermectin and COVID-19 Study. And so it was just published. And so just so you all know, what they found was it was a retrospective cohort study in South Florida. And what they found was that there was a statistically significant lower mortality rate in the group treated with ivermectin as compared with the group treated with usual care. It was 15% versus 25%. So therefore, there was a difference in mortality. And this is a peer-reviewed, very well-respected journal that most pulmonologists read called Chest. In addition, you could also let them know that if they look at clinicaltrials.gov, currently, there are over 37 studies investigating the usefulness of ivermectin, and that's just in the United States. The global literature, especially in South America, is robust with epidemiological data of decreased morbidity and mortality using ivermectin. Specifically, there was a slide of eight provinces in Peru where 2 of the provinces used ivermectin, and you could literally see a drop in mortality from COVID in those 2 provinces, as opposed to the rest where the mortality followed the cases. And so do your due diligence, try to talk your doctor, and if you can't find help, then reach out to us and we'll try to help you.
Well, I think this is really wonderful, because the thing that is new in medicine in 2020 and beyond, this is the future, is that there's so much data available. There's a lot of sick people, and so doctors are inundated. And we've talked about this before, that it takes 17 years for a study that was published today to be in the hands of the general practitioners. Do you know how long that is? That's a long time. So the reality is that it is important that you educate your doctor, and it is important that you educate yourself. So the consumer has to be educated, and the consumer just has to be able to have a conversation with a physician who's open to learning. If they don't know, especially. If they do know and they understand ivermectin, that's great. Stop there. Adding more information is not really helpful because they're already inundated. The other thing I want to say on this early outpatient protocol is it says early and it says outpatient. So that means this is for the treatment of acute disease. This is not for the treatment presently of post-acute COVID syndrome. This is for acute disease. Chronic disease is a whole different story. Chronic disease has to do with the immune system, which is what we're trying to get you to fortify for $5 a day, because it's really important. It will help to prevent post-acute COVID syndrome. The next thing that will help prevent it, the second thing, not the first thing, is early outpatient treatment for acute disease. So both of them go hand in hand, and they're directly linked in helping you to avoid having a syndrome that lasts a long time that others don't understand, meaning other doctors don't understand. So I do really advise that you invest whatever it costs, $5 a day for your immune prophylaxis, your immune fortification, and that if you are sick, you have this treatment as quickly as possible in the acute phase. Chronic COVID, post-acute COVID syndrome, we'll talk about next week. It's different. The treatment is different.
Good point.
Questions? Linda has her hand raised. She could
So
type
yeah,
in
so
the chat.
I wanted to let you know that at that website, there's a huge bibliography of peer-reviewed articles, world literature, as well as a very academic presentation by Dr. Corey, the presentation and the review of the world literature from last week. So it's a really great resource, and I'd refer you to that website. Next slide.
Okay. Next slide. So this is the basic immune pack, the CD, which you've seen on all these slides. You've heard it over and over again. There are multiple ways to take it. I happen to like the liquid way, but it doesn't really matter for D. For C, I like powder, but you can take capsules. The omega-3 is critically important. Not many people talk about it, but it is a marked anti-inflammatory, and I think it's very important. And the literature that supports that is linked in our Kick COVID to the Curb book. Zinc is on every list. Quercetin is on every list. Colloidal silver in your medicine cabinet will help you with the flu, COVID, strep throat, all of those things. And Neo40 is just a remarkable vasodilator through the nitric oxide pathway. So these are the best.
And if you were to get sick, the top line gets tripled. The CDOZ, C-D-O-Z, you triple it acutely if you were to be exposed or sick. Next slide.
Here we are with the updates.
So there's been a lot of tests that are positive, but again, remember that they don't differentiate sick and positive from just positive. So it's really hard to really understand the data. So yeah, 20 million tests in Florida, 1.7 million confirmed, 28,000 deaths. In our county, Alachua County, 21,000 confirmed, 106 deaths. In our practice, we've managed about 100 COVID positive or COVID positive sick patients with 3 deaths we've already shared. So very rare. I feel bravo to our team and Dr. Kathleen for helping us with these protocols. And
Bravo,
you all for
bravo.
listening so well.
Yeah, bravo. We have, it's growing. What am I going to say? It is what it is. I don't really know what all of the data on the left means, except for the deaths for sure. And on the right as well. I mean, total confirmed. I'm not really sure if they're sick or they're just positive. So I get frustrated by the data that isn't specific, but we have, a lot of cases here in Massachusetts. I'm sure they're going to have a lot more in Florida and Tampa after the football Super Bowl, because there was a lot of activity going on there, and that will probably occur in the next 2 weeks, but we didn't have it here. So I would rather win the Super Bowl than not, here and be celebrating, but just saying. Okay, next slide. This is the vaccine tracker, and it looks like we're doing a better job. We went from 1 to 2% last year in terms of the different states and the population, and now we're at, roughly 2.8 to 3.5%. So it's growing. I think it's getting more and more organized, and I think we're doing a better job.
Okay, so we walked you through all of these stages. And we're going to answer the questions we didn't answer next time, but I hope you join us. We hope you join us for the post-acute COVID-19 syndrome packs for people who are still unwell after having recovered from acute COVID. It's like repairing your castle.
Ooh,
can you have the flu and the COVID at the same time?
I wish I had screens and people could raise their hands, but go ahead. Yes.
Even the early study said you could have co-infection, not only with flu, but with other viruses like respiratory syncytial virus, which is what happened to our NFIM patient number 1. She actually was diagnosed as RSV, and it wasn't until a month later that she had positive antibodies to COVID that in retrospect, we realized her hospitalization was both COVID and respiratory syncytial virus. And her lungs are still struggling. That was way back from the acute infection in March.
Well, and you can also have a superimposed bacterial infection on top of COVID, which is the flu is a virus, but you could have a bacterial infection as well. So the protocol that we looked at may be individualized, and they may add an antibiotic like a doxycycline or azithromycin. And if you have the flu, they may add, Tamiflu for the flu. So that's why it's important to absolutely be seeing a doctor that knows you and that follows you over time. Next slide.
Yeah, and to that point, you could have bronchospasm and you might need nebulizers. I mean, there's a lot of things you might need nuanced with the tempo and progression of whatever your illness manifests itself as. So we're going to ask that you send in your Q&A, and the ones that came up today that we didn't get a chance to answer, we'll address just like we did. We were going back to last week's questions, but please join us for the post-acute COVID syndrome discussion. Dr. Kathleen and I are actively involved in designing a clinical trial to help our patients get better and recover from the PACS, post-acute COVID syndrome. All righty, everyone. For now, be safe, be well, and God bless you all. Thank you, Audrey, and thank you, Dr. Kathleen from Boston.
Thank you all. Hope we can answer your questions, more of them next week. Send them in. Thank you. Bye.
Okay, everyone. I will definitely write down all of the questions in the chat and make sure that all of them are included in next week's webinar and will be answered. So don't worry about that. And then before I let everyone go, I'm just going to go over the supplement and book offerings as always. So this week, throughout this whole series, actually, we've been promoting the Basic Immune Pack. And this is one of the supplement bundles on our FIRRIMup Get Healthy store. So if you navigate to that link, all the bundles will be right at the top. And the doctors went over this today, but it's just that CDAWS protocol. So vitamin C, vitamin D, omega, zinc, quercetin, colloidal silver spray, and Neo 40. And all of these you can get at that store. And we have the standard version, and we also have the vegan version as well. And then we also have the post-exposure prophylaxis bundle. So that's going to be the same foundation as that basic immune pack bundle. So the CDAWS protocol. And the only thing we're adding here is the immune PRP spray. And as always, we do have the standard version and then the vegan version as well. And you can get that at our FIRRMupDoctors Doctors Get Healthy store. And next for our books. So yes, we are still selling the Kick COVID-19 to the Curb book, very relevant for this whole series and through this whole pandemic. Great guidance in there and great information to help give you reassurance through everything that's going on. So you can get that in the paperback version for $29.99 in our office, but you can also get it at our FIRRMUP Doctors Get Healthy store. And then you can get it online as an ebook for $9.99 at Amazon Kindle, Google Play, and Barnes & Nobles, or on Audible for $14.95. And then if you're new to Audible, your first book is free. So definitely take advantage of that. And if you purchase this book in any format and you send us the receipt via email or picture, we will honor a 20% off coupon for ultra potent vitamin C and zinc AG. And then next we have Dr. Akey's Fine Tune Your Hormones Symphony book. So this book is an overview of your hormones and how to balance them for overall wellness and health. And this book is on our FIRRMupDoctors.com website. And we also actually have it on Audible as well. So if you're new to that, you can get your first book free. And then lastly, we have our Fascia Function and Medical Applications textbook from Dr. Akey, and we have some hardback copies still left in office. So if you email nfimgmv@gmail.com, we can offer curbside pickup for that book. And then we can also give it to you in the paperback version on the FIRRMupDoctors.com website and Amazon.com as well. So that's all I have for you. And thank you so much for joining us for our 4th week. Next week will be our last week of the 5-week series for COVID, and we'll be talking about post-acute COVID syndrome. So what happens after you have COVID? I know a lot of people are struggling with still having symptoms. So they're going to give some clarity and information on that. I'd love to see you here. Thank you so much and have a great week, everyone.
We're so glad you joined us today.
We hope we've given you the tools to take control of your health.
For more good medicine and information about any treatments, supplements, and resources discussed today, please visit us at www.FIRRIMupDoctors.com. That's FIRRIM Doctors.com.
And wherever you're listening from, remember to like us on Facebook and subscribe to our YouTube and podcast channels so you don't miss out. The information provided is not a substitute for professional medical advice. This should not be used to diagnose, treat, or manage health problems without consultation. If you do experience any of the symptoms discussed today, please contact your nearest healthcare